Well, hello and welcome to HIPAA Chat. I'm Carol Flagg of High Tech Answers and the Health IT Answers Media Network. Thanks for joining us today, our first HIPAA Chat of the year. Got a lot to talk about before we take your questions, and we'll dive into that shortly. Before we begin, we want to thank our sponsor, eFax Corporate. eFax Corporate is a brand of J2 Cloud Services for 21 consecutive fiscal years of revenue growth. As of December 31st, 2016. They have several products dealing with the secure exchange of ePHI, so please check them out at enterprise.efax.com. And back with us again to start the new year is healthcare attorney David Harlow. He has 25 years of public and private sector experience. His focus is digital health law and policy, and of course, including HIPAA, our topic for today. He works with vendors, providers of all sizes, payers, and more. You can contact him directly at david@harlowgroup.net, and of course you can read his regular blog posts at the health blog, blawg.com. If you'd like to check out past HIPAA Chat events that you've attended, or if you're new to HIPAA Chat, you can find them on our YouTube channel. If you just go to YouTube and search HIPAA Chat or High Tech Answers or Health IT Answers, you'll come across the playlist of past HIPAA Chats. We also provide podcasts of past shows on our internet radio station, healthcarenowradio.com. If you go to the website, you'll see with very little effort how to find those downloadable podcasts. And of course we stream HIPAA Chat on our internet radio station, healthcarenowradio.airtime.pro at 12 noon and 7 p.m. Eastern. If you go to any of our Answers websites, you'll find a radio player that you can click to listen to that and other shows. And of course, follow us on LinkedIn on HIPAA Chat, where we take additional questions and discussions. David, it's 2017, and we're starting off the new year with, of course, plenty to talk about in the HIPAA arena.
Yes, welcome to 2017, everyone. And lest you thought otherwise, the government is still interested in enforcing the HIPAA rules. And interestingly, they're starting off this year with an enforcement action relating to part of the rule that has not previously attracted enforcement activity. I have to say that it's relatively usual for agencies to take a staged approach to enforcement actions. That means they give us a little time to get used to the rules before they start slapping people down for breaking the rules, even though that's not necessarily required by law. But in this case, they've been waiting quite a while before initiating enforcement actions regarding the breach notification rule. Quite a number of years since the high-tech Act related HIPAA rules, the omnibus rule, was promulgated. We're going on, what is it, 4 years now, something like that?
It's October 2013 when the omnibus passed.
Right. So it's a little unusual for the enforcement agencies to wait that long to begin enforcement, but this day is here now, and it should not come as a surprise since we've known about these requirements for a while. Essentially, the rules require that notification about a breach go out from the covered entity whose PHI was breached to the patients whose PHI was breached within 60 days of discovery of the breach. And that has been taken by many to be sort of a soft deadline, and that's where Presence Health got into trouble. So Presence Health is a significant sized healthcare network, 150 locations, 11 hospitals, 27 long-term care facilities. So this is not a small physician office. This is an organization that should have a health IT central operation in place, a data security and privacy operation in place. Nevertheless, they were aware of a breach and did not inform patients for quite some time. And again, the rule is 60 days, right? And in this case, there were something under 1,000 patients affected by the breach, and there is a requirement there's an additional requirement of notification where a breach involves more than 500 patients, right? In a smaller breach, there's a requirement for individuals to be notified directly, and where there are 500 or more individuals affected, there's a requirement that notification go out to local media outlets so that the general public can be made aware, because it may be difficult in the case of some large data breaches to positively identify each individual whose information was affected. So the idea is to get the word out generally. So hey, if you're a patient of Presence Health, there's this breach. We think it was limited to 800 or 900 individual records, but we just wanted to let you know. They didn't do that for quite a while too. Again, the issue is, should have been done within 60 days. It wasn't. Therefore, that's a breach of the rules. Therefore, the provider is subject to a fine. Now, in this case, it's a fine of $475,000. In the scheme of HIPAA fines, it's not a lot for an organization of this size, but again, that's sort of consistent with the agency's approach. Okay, we're going to get into the breach notification enforcement mode. We're going to start small. Here's an issue that came up. We know it's a big organization. It's perhaps a slap on the wrist size fine for an organization of this size, but again, it affected, as far as we know, 800 some individuals. It's not like it involved hundreds of thousands of individuals. So people should know that this is happening, that this is out there. The rule has been on the books for forever, and now it's being enforced.
Yeah.
So a question might come up, how do I deal with this?
Right.
And one thing, and perhaps if there are questions on this, I'd be happy to take them later, but one overarching comment I have is, think about how you write your business associate agreements, okay? To the extent there is a business associate who is responsible for the breach, in this case it was a covered entity breach directly, but often these breaches are at the business associate level, and then the question becomes, how do you manage this through proper drafting and negotiation of a business associate agreement? Do you give a business associate the full regulatory 60 days to let you know about a breach, or do you demand more immediate reporting? Obviously, it's in the interest of the covered entity to demand more immediate reporting. And again, we can talk about that further.
Yeah, and you know, I did the math real quick, and that 475,000, you know, doesn't seem like, compared to other fines they've issued, but that is about $600 per patient record. So, you know, when you look at it that way, obviously, if it had been 10,000 records or something like that, in a similar kind of per patient record, it would have been a really hefty fine.
That's right. Yes.
Yeah. And then, not to be, of course, outdone by HIPAA and the omnibus and what we've got going on there, ransomware continues to start off, you know, everybody's morning breakfast news media, right? Reading about HIPAA, the latest ransomware attack.
Yes, ransomware. So last year, way back in 2016, there was at least a debate about whether a ransomware attack would constitute a reportable breach. And while I would still say that reasonable minds may differ around the edges, OCR, the enforcement agency, the Office for Civil Rights within HHS, has come down on the side of, yes, it is reportable. So just keep that in the back of your mind. Later, if there is a ransomware attack, that is reportable as a breach. And I have written about this on my blog, Health Blog,
Yes.
and you can find that post with links to the government guidance there as well. But the latest ransomware attack is worth looking at, because I think it is significant in a number of ways, and let me highlight some of the markers that make this significant. It was a ransomware attack that was made possible through the misconfiguration of an open source database software package that is very widely used. It's called MongoDB. And the issue here is that folks love free software, right?
They do.
Open source software. And the problem is that not all open source software out of the box is configured to be as private and secure as it might be. So there's work to be done when you use a tool like this, and not everybody does it. And certainly with smaller organizations, if you don't even have a dedicated database IT person, it becomes even more difficult to organize that sort of continual updating and patching. One issue. Another issue that I think warrants highlighting here is that the amount of ransom demanded in this instance was 0.2 Bitcoin.
That's not a
Now,
typo. It is. It's 0.2.
I have not, you know, I'm not tracking the Bitcoin market on an hourly basis, but a Bitcoin is now worth less than $1,000. So we're talking under 200 bucks ransom that is being demanded here. Now what does that say? That says to me that someone using this exploit did not just find that Emory Healthcare had something exposed. They found that thousands of MongoDB installations had data exposed, and they're willing to go for a real lowball price because they feel they can collect it from thousands of parties. And in fact, the latest estimate puts the number of misconfigured MongoDB installations at about 100,000 across the country. And as recently, you know, as by the end of last week, almost 9,000 databases had been affected by this particular exploit.
Wow. Well, that is a volume issue because, again, if you do the math, that's about 20 million. And that's a low enough number for ransom that obviously probably anybody would pay that.
Right. So then the question comes up, should I pay it? Right? So when the FBI is negotiating the release of hostages, they say we don't pay ransom, right?
Yeah, yeah.
Do we pay ransom in the case of a ransomware attack? Well, the pragmatic among us may say, hey, 200 bucks, sure, I just want my data back. Peel that back another layer. How do we know that the data still exists? We don't. It is deleted from your database. Who says that this Harakiri gang has even kept a copy of your database? They just want the 0.2 Bitcoin. There's no assurance that A, they have it, and B, they will actually restore it.
Right, right.
All a long-winded way of saying do your own backups,
Right.
patch your own software. Prevention is the way to go here. Picking up the pieces afterwards is difficult, if not impossible.
Yeah. And like you said, you know, be really careful open source because, you know, free is good, but you know, sort of, you know, buyer beware.
As we say in other contexts, if the product is free, then you are the product.
Right. Right.
Like in the context of thinking about Facebook, for example, you are the product, right? Never forget that. So if you're using open source software, you don't want to be the product.
Ever, yeah. Well, with that lead in on these two topics, obviously we're going to be talking along the way as we take questions from the registrants and of course questions from our live audience, you know, weaving in some best practices to stay compliant or become compliant as far as breach notification, the HIPAA compliance laws, and of course ransomware. During our Q&A, pose a question using the question box on the right side on the dashboard. Also, if we don't get to your question or you want more additional information, if David addresses your question, you can email him directly at david@harlowgroup.net. Once more, check out his terrific blog, healthblog, blawg.com, and you can follow David on Twitter at healthblog. So we're going to go ahead and dive in. I'm going to start with a couple of questions from the registrants that were sent in earlier, and then we'll take some live Q&A. First and foremost, can you talk about particular risks to patient safety when a breach notification is delayed, as we talked about with Presence Health?
Sure. So again, the rules require a notification to go out within 60 days of discovery of a breach. And then you might ask, well, what's the point? What is a patient going to do with that information, right? Well, often the breach notification goes out with an offer of some services to mitigate the potential damage. So part of that relates to what's included in the breach. I mean, in this particular case, it was patient names, dates of birth, medical record numbers, procedure dates, procedure types, surgeon names, anesthesia types. That may pose a privacy concern, but it may not pose a financial damage concern. Often, however, these breaches also include payment information, or insurance information, or co-insurance payment information, credit card numbers. So that creates a whole other kind of potential risk. And in those circumstances, often the breaching parties offer credit protection of one sort or another to individuals. And obviously, the sooner that an individual learns of the need to pursue that credit protection, change credit card numbers, etc., the easier it is to avoid additional fraud. So sooner is better. That's really the bottom line. People who steal this sort of information are often interested in reselling it to the highest bidder. So it's posted on the dark web, it can be bought by somebody else, and it can be used in different ways by other illegal users of the information, with the name, date of birth, and other information that could be triangulated from that. Other users could apply for new credit cards in the patient's names and sort of charge up costs to that individual, eventually putting that individual in sort of financial default situations on cards that they never applied for or used themselves. Again, the more time that elapses between the discovery of the breach and the notification of the individual, the more damage can be done and the harder it may be to undo the damage.
Okay, and that the question from the live audience, that 60-day window that you're talking about, is that 60 days from the time the breach was identified, or 60 days from the investigation of a breach, or 60 days from the day that you identified the breach occurred? Like, what if you didn't know for 3 weeks? Yeah.
Right. 60 days from the discovery of the breach.
Okay.
Right. So to sort of pursue a little bit further, what does that mean? Why did it take you 3 weeks to discover the breach?
Yeah.
Aren't you doing log audits? Aren't you doing some sort of reviews on a weekly basis? Depends on the type of breach. In this case, it was a paper breach. There was something went missing from an operating room administrative area. That should have been reported up the chain immediately. That could have been investigated. The process could have started within the week. I mean, there's no reason for delay in a situation like this. And that really goes to another point, which is that, as we talked about sort of best practices, there need to be procedures, policies and procedures in place that address all of these sorts of eventualities. And the eventualities that may come up will differ from place to place. There are certain commonalities, but obviously not everybody has a operating room suite with paper records. So you need a procedure to capture, what happens in this particular circumstance. The other issue that this highlights is the need for training of
Yeah, right,
staff
right.
to the rules and to the standards and to the policies that are adopted by the organization. And there needs to be, training and testing on those policies so that staff are, it's not enough to say, here's a copy of the binder, sign a receipt that you received it and that you've read it, because we all know that you give someone something like that to sign, they'll just sign it. It's no guarantee that they've actually read the thing. So it makes sense to put people through, for example, I help put people through an online video instruction process on an annual basis that includes a post-test, and that the fact of viewing the video and the score on the test is kept as part of the records of the employer. So it's an important part of the compliance process. We can't think of compliance purely in terms of what do we do when something bad happens? Do we follow the rules then? Again, I want to focus on trying to prevent the breach from ever happening in the first place.
Right. And so we've got a couple of people asking, so in the case of Presence Help, that lack of timely breach notification, obviously the breach was discovered and they must have exceeded that 60 days by a little bit or a lot or
I
whatever.
imagine it was a lot.
I
I don't
imagine
have
it was
that in
a lot,
front of
yeah.
me, but I think it was on the order of months and months
Months and
in this
months, right.
particular case.
Right. Several questions trying to get a better understanding of what to do for a particular requirement when this 500 threshold is reached in a breach event. Is it the same for all providers? Does it differ based on size, or the 500, of course, being sort of the benchmark for when you have to notify patients and notify HSS and whatnot?
Right. The patient notification timeline is the same no matter the size of the breach. The size of the breach, the 500 patient threshold, relates to two things. Number one, it requires an immediate notification to HHS as opposed to a quarterly or end of year notification. And it requires notification to go out to local press outlets. So
Right, you have to know, you
basically,
have to let the
if you're
media know,
over,
right?
right, if you're over 500 records, then the point is that's considered a large breach, and it needs immediate action and it needs broad action. Doesn't vary based on type of provider.
Got it. Observation from one of our attendees, for Medicare patients, the patient number is their social security number, cleverly hidden by adding an A at the end. So if it's a Medicare patient and that patient record's breached or ransomed, you're talking the person's social security number, which can be devastating to the patient, obviously.
Right, absolutely,
And worth a
and
lot
we
of
really
money.
need to move
Yeah.
away from that. And there's been a lot of discussion about creating a unique patient identifier.
Yeah.
Congress, in its wisdom, has prohibited the expenditure of federal monies on implementing a unique patient identifier, and that's really something that we need to move towards if we're going to limit some of the opportunities for breach and damages to individuals.
Yeah. Are there any case points that you're aware of for a covered entity being fined or held liable for a business associate causing the breach, assuming that the CE had a good and current BA agreement in place?
Right. Now business associates are now, since the passage of the High-Tech Act, have primary liability. So if the bad act was on the part of the business associate rather than the covered entity, it's the business associate that's going to get fined rather than the covered entity. The covered entity could get dinged one way or another, may or may not rise to the level of a fine for not doing appropriate due diligence with respect to the business associate. Okay, so you can't totally palm things off on a business associate. You need to do your due diligence up front when you're engaging the business associate. So what does that mean? You need to be assured that they are compliant, and not just because it's your brother-in-law or
Right, right,
they said so on their website.
right.
You need to have a demonstrable set of steps that you've taken to figure out whether or not they are compliant. Now, what does that mean? Now, in sort of the small business associate or intermediate sized business associate, that would mean to me that you send them a questionnaire. And I work with people to devise these questionnaires, and there's some forms are probably available online. But you want to try to elicit from somebody a sense of how seriously do they take data security. What are they actually doing on the ground or in the cloud that is securing the data that you're entrusting them with? Because you are liable as well. Again, if a breach is clearly the fault of a business associate, it's unlikely that OCR would fine the provider as well. But if you haven't done your due diligence and you can't document that you've done your due diligence, then you would likely be on the hook as well.
And obviously this business associate side of it was the fines and responsibility was strengthened under the omnibus, and of course with the current audits that are going on, there's been a lot of focus on the business associate side. I think that certainly the OCR sort of recognizes that this could, I mean, is an area of weakness.
Right, and this is sort of the first time that
Yeah.
business associates need to be prepared for OCR audits. And OCR has basically targeted a certain number of covered entities, and they've asked those covered entities to identify all of their business associates, and they're going to select a representative sample of business associates based on size, type, etc., to audit those directly.
And then we get this question, I think, almost every HIPAA chat, which is how often do your business associate agreements need to be updated?
So I think that the short answer is that business associate agreements don't necessarily need to be updated unless there's a change in the law or the rules. However, there's always a however.
Right.
Your entire compliance program, your privacy and security policies, your implementation of those policies should be reviewed on an annual basis, or more frequently if there is a change in your IT infrastructure or operations that affects patient data. Because if you're changing the way you do things, you need to re-look at how you're maintaining the privacy and security of data. Hopefully that's not too much of a logical leap. Hopefully I don't need to go into greater detail on why that is true. But how you do that involves doing a risk assessment on at least an annual basis. That's something that can be done internally, or in many cases it makes more sense to outsource that risk assessment, because you want to get a security expert to do that risk assessment. There is sort of a self-serve questionnaire on the OCR website that basically has the audit questionnaire that they may be basing their audits on, so you can sort of use that as a guide. Excuse me, there are other guides available online as well. But ultimately, if you're trying to tell a good story about your compliance, the story is better if you've had an outside party come in and do the risk assessment for you and report to you, and then you have a sort of a vulnerabilities report at the end of that risk assessment, and you need to address, and you need to document that you've addressed those vulnerabilities in a reasonable way, right? Things that are, you can sort of rank these as sort of, green light, yellow light, red light. The red light items that turn up in a risk assessment as vulnerabilities, you need to address right away. Others can be addressed over time.
But they'll under that you just have to figure out what needs to be mitigated and how fast, right?
Exactly.
Yeah.
Right.
So I'm going to sort of move into the questions coming in on the ransomware side, and some of this actually relates to breach notification. So first and foremost, one of our attendees wants to know, what exactly is ransomware? Is it an individual hacker, or is it a company paid to hack healthcare systems to test HIPAA compliancy?
So broadly defined, ransomware I would describe as a type of malware, right? So it's we've all heard of Heartbleed.
Yeah.
We've all heard of other sort of individual exploits. So basically there are people, there are hackers out there in the world. Some are quote-unquote black hat hackers, some are white hat hackers. I'll get to that in a minute. But basically hackers will probe broadly used types of software for security vulnerabilities and build pieces of software that we call malware that can exploit those vulnerabilities and do bad things. In this case, the ransomware is designed to either lock the software so that the proper end user is completely unable to use it. And in this latest iteration, we're hearing not only lock the software and the data, but actually wipe the data from the installation, wipe it completely. And we don't know whether or not it's actually saved somewhere else, so that if you pay the ransom, you can get it back. So the ransomware interferes with the usual use of software. Could be put out there by, as I said, black hat or perhaps white hat hackers. A white hat hacker wouldn't be actually sending the ransomware out and demanding ransom payments from end users. They might identify the security hole in the software, in this case MongoDB, and would contact the developer of the software and say, hey, I found this security hole and you'd better patch it pronto because your users are going to be hurt if you don't.
That's
So
the lab.
that's
That's the
sort of
LabMD case. Well, that
well,
was a white hat, wasn't it? Yeah, sort of similar situation. Of course, that was.
well, that was somebody who exploited an existing
Oh,
vulnerability
that's
and
right.
then
Yeah, yeah.
offered to take care of it
Right,
for a
right,
fee, and then went ballistic when the fee wasn't paid. So I
right.
wouldn't call that white hat
No,
exactly.
that's extortion. Yeah.
Yeah, right. And there are, there are sort of a whole variety of permutations on this. There's even a case, I think we may have discussed this before, where a vulnerability in a medical device was identified by a hacking team, and they wanted to appear to be white hat hackers, and they released a press release about the vulnerability, identifying the company that provided this medical device that had a software vulnerability. But before they released the press release, they shorted the stock. It was a publicly traded company. They knew that their
Oh.
press release would cause the stock to fall in value, and they made money.
Oh, wow. Yeah. Yeah. I can't do that either. That's that is also
Right.
fraud,
One would
right?
think that that's securities fraud.
Yeah, right, right.
Uh,
That is fraud, right.
question about whether or not that is, whether it meets the definition of securities fraud, but obviously, just on the face of it, not a nice thing to do. It may violate one law or another. But the point is that ransomware is sort of a catch-all description of a certain type of malware that is used, here we're talking about black hat hackers, to lock your data and extort money in exchange for a promise to unlock it.
Right.
So what do you do? How do you avoid getting into this problem? How do you avoid, I mean, it probably sounds like this is inevitable, right? MongoDB is a broadly used database package. 100,000 people had this vulnerability. 100,000 installations have this vulnerability. How do you deal with this? How do you get around this? So, I mean, in brief, the answer to that is, you know, if it's free, like I said, you are the product. Another way of saying that, you get what you pay for. A lot of these open source software products are really excellent tools, but it is important, it's critical to pay the money that you need to pay in order to have them maintained properly, whether that is through someone on staff or through add-on services, commercial services that are add-ons to open source software. And sort of one example that comes to mind is the Linux operating system, which is a free open source operating system. Many large enterprises use Linux for their operations, but they either have a staff dedicated to maintaining Linux security and usability, or they contract with a company like Red Hat, which is a commercial operation which, you know, maintains Linux installations. So you need to do both. You need to maintain your software in a way that is as secure as it can be. I mean, by its nature, there are going to be vulnerabilities, and these things get exposed over time. But you need somebody whose job it is to make sure that your exposure is minimized.
Are covered entities able to conduct a risk assessment of the ransomware to determine if it's a breach?
So the agency has spoken and has said that if there is a ransomware incident defined as someone installs malware on your system and you now do not have access to your patient data, that is a breach by definition. That's reportable breach. Now, you might be able to restore functionality if you've done all the things that you should do in terms of regular backups and so forth. Perhaps you can clear the decks of the ransomware locked software, reinstall your software, and then restore your most recent backup of your database, right? So you've addressed the functioning, you know, how do you run your business question, how do you run your practice question. However, the breach has still happened. So
Right.
it's still a reportable breach, okay? So it's a reportable breach, but you don't have to pay the hacker.
Right.
Because you're able to restore a recently saved backup of all your data.
Right. And so it's recovered and it's still on the premises, but a breach still occurred. And even if you think that, even if you're not sure whether the other side of the ransomware got the data, the records were still breached. Is that correct? Because how would you know, right? Unless they ransomed it, and even then you might not still know. But yeah.
Right. There's no way of knowing to a certainty that somebody on the other end of the internet hasn't taken that data and decided to sell it on the dark web or do something else.
Right, right. Can you give some best practices for small covered entities for preparing for ransom attacks? And you've talked obviously about that with open source software, but there are obviously other ways that these ransomware attacks can occur. The Emory Healthcare was a piece of paper, right?
No, that was the Presence.
Oh, that was a Presence Health. Yeah,
was a piece of paper.
Yeah, Emory Healthcare. That was the MongoDB, right?
So, yeah, I mean, again, the best offense is a good defense, and I always advocate for preventive steps, preventive measures that can be taken. The MongoDB example of ransomware um, the vulnerability was there due to the failure to patch and maintain and configure the software properly, to maintain proper level of security. Other ransomware and other sorts of security breaches are made possible because of poor data hygiene, I would call it, or poor security hygiene. And this can be as simple and frankly as problematic as anyone in the organization could receive an email that looks like it's a believable email that
Sure.
says click here in order to do something that sounds reasonable, and you click and your machine is immediately infected with some malware that either scoops your passwords or logs your keystrokes or otherwise establishes a foothold inside your otherwise secure perimeter, and then can sort of at its leisure go around, snoop, see what it can find, and exfiltrate that data back to the home base. So a lot of this has to do with training of individuals in how to identify phishing
Right, right.
emails or other messages. Phishing can happen on Facebook. Phishing can happen through Instagram. Anywhere where someone can get you to open an email. You don't even have to click on a link sometimes. Just open an email, and that could cause a problem. Click on a link, whether it's email or Instagram or somewhere else, cause a big problem. So a number of things to do. There are hardware appliances that you can install as part of your firewall that can stop some of those things. You configure them, and they have regular updates coming over the wire, and they will stop some of those messages at the gates. However, not everything will be stopped. The patterns are constantly changing. You have people who are working full-time, Macedonia, Ukraine,
Yeah,
elsewhere around the world. This
right.
is what people do, and they're just trying to get through to somebody's network through their network defenses and to their data. So you need to be aware of things that change over time, what might come through, and perhaps the best thing to do is for an IT staff, either internally or through an external resource, to send on an unpredictable schedule mock phishing emails,
Oh, yeah.
right? So try to spoof your staff into clicking on
Right,
something that they
right.
shouldn't. Okay, but when they click on it, they don't give away the keys to the store. Instead, they come to a site that you've set up that tells them, hey, you just did a very bad thing, and
Right.
here's why. And let me show you what you could have recognized in this email, how you could have seen this to be a phishing email. So it's an education opportunity in a way that's delivered in a way that the actual threat would be delivered. And I think that's a very valuable lesson for end users.
Yeah. Um, Certainly because regardless of what your policy is, obviously there are staff members out there still surfing the web on Facebook, on Instagram, on Snapchat, during the work hours. Just it's tough to patrol that.
Right. And again, some of these hardware appliances that you can add to your network security perimeter will stop some of that, or will simply not allow you to actually click on a link if it's on a blacklist. But it's not a perfect solution. So you need
Right.
to do that plus some of these other things that address what we call generally, human factors.
Right,
Right?
right. Speaking of human factors, could you give us some ways we can keep patient data secure with laptops and cell phones in the field? All of our clinicians have these. It's true.
Sure.
Yeah.
So first question is whether these are practice-owned laptops and smartphones or if they're personal devices. If they are personal devices, query whether you want to impose a ban on accessing PHI through personal devices. If you can't do that, then you need to think carefully about how you handle sort of device management. If somebody is logging into your network on their own device, there ought to be some tool that would be downloaded onto the end user's device that would allow you to wipe it remotely if it is lost or stolen. And you need to, number one, get people's consent to do that. And
Right,
number
right,
two, if it's their personal device. And
right.
number two, or maybe number one,
Yeah,
train
right.
them. Say, don't lose this thing. Don't use it in a coffee shop on coffee shop Wi-Fi. Get a screen, a polarizing screen cover so that somebody can't, you know, as we say, shoulder surf
Mm-hmm.
and even read PHI over your shoulder. There are a lot of steps that can be taken and a lot of training that can be offered in order to minimize the potential for losses through these sorts of things. But a key thing is, because it often comes up in the case of either, you know, coffee shop Wi-Fi or a device being lost or stolen. So you need to sort of, I think, hit those as the top areas of concern. So you have the device management software. So if it's stolen, you can just remotely wipe it entirely. And, you know, you'll have cases where somebody reports something lost or stolen and then they find it later in the bottom of their bag and you've wiped it. And they're going to be upset with you because they had their kids' pictures on the phone.
Right,
Um,
right. Of
but
course. Yeah, yeah.
But that's what you need to do, and you need to offer people resources and tools and education on how to back up their own data. Uh, we've all had to deal with that one way or another.
Yeah. And a quick comment, somebody just chatted to me, and all of that should be, I, I assume, documented in our risk assessment analysis.
Yes, absolutely, because one of your risks is exfiltration of data through personal devices. You need a BYOD policy
Right,
that
right.
covers all of this, and then you need to implement that.
We are an IT management company located in another country and doing a risk analysis for a client. What obstacles should we prepare for? I guess they can't do I guess they're doing remotely, not on site, obviously, but
Right. I think the key issues there are sort of the question of on-site versus remote
right.
risk assessment. There are some folks who would say that it is impossible to do a compliant risk assessment without being on-site because frankly there are physical issues that you may want to have eyes on in order to be able to sign off on an assessment. But as I said, people differ on that. I don't think that's clear cut one way or the other.
Hmm.
The other issue is sort of the concern about doing this remotely and concerns that providers and other covered entities may have about using offshore resources in general. I think there is a legitimate concern in using offshore resources for storage or processing of PHI unless certain protections are in place and you're confident in those protections. Just as an example, and not to diss any particular offshore resource, but the court systems of other countries operate sometimes at a vastly slower pace
Right,
than our court
right.
system does. So if you're going to rely on the enforcement of a contract in a foreign court, that may not be adequate. You may need to think about having arbitration or mediation clauses and use a recognized arbitration service in that part of the world, other things like that, and simply sort of is somebody beyond the reach of the law in the U.S. if they're in certain countries. That's
Right.
something to consider.
Right.
But technically, you can certainly do a lot of this remotely, and that's certainly done within the U.S. No particular reason why the assessment couldn't be done from beyond the U.S. so long as the personnel conducting the assessment are appropriately trained in the U.S. Standards.
Right. In the case of a data breach, could forensics determine if the data was accessed, used, or disclosed rather than just encrypted?
Not necessarily. And that's sort of depends on the specifics of the installation and the breach, and much of that is really beyond the scope of what I could answer, sort of beyond the scope of my knowledge on the technical side.
Right. So if there, I mean, I imagine there probably are companies that do that. You would have to ask them, right?
Right, and I've been through this process with clients over the years, and sometimes the answer comes back, gee,
Yeah. Right. Right.
don't know, can't tell you.
Can't tell you that.
I know you want a definite answer, but I can't tell you that nobody looked at it.
Right. Right.
Uh,
Right.
so then you have to do sort of a weighing of risks, right? Do you want to not report something and then be found out later that you didn't treat something as a breach and it really was, and you could be on the receiving end of one of those $500,000 fines, not to mention disgruntled patients, et cetera, et cetera.
And public, right? Your public,
yeah, the PR issue.
PR side of it, right?
Yeah, but that's always a balancing act. There's PR consequences to disclosing a breach as well.
Right. Do you recommend having shredding company shred at the covered entity location or at the site with a BAA signed and in place? Well, I guess the question is, so they pick it up and they shred it right there on site, or they take it away and shred it off site? Of course,
Right. So, some companies have shredding trucks that pull up to the curb, and you have your locked bins of PHI paper, and it goes straight into the shredding truck, and that's fine. I think from a policy perspective, either approach is okay, as long as you've done your due diligence with respect to the physical security. Right? This goes back to a comment I made earlier. Just because your brother-in-law says he's HIPAA compliant doesn't mean he is.
Right.
You need to do a little digging to make sure that they're actually doing what needs to be done.
Yeah, and of course document that in your risk analysis. Somebody sent me a quick note, and if you said it, our apologies. How often do you recommend doing risk analysis again?
Right. So I think the quick answer is annually. However, if there's a change in any of your processes, including types of software that you're using, then upon the change, you should be doing a risk assessment as well.
Right. Or perhaps a certain maybe an employee leaves under circumstances that you'd want to make sure that you're covered there if it was a disgruntled employee or something like that.
Well, if you have a disgruntled employee walking out the door with a laptop situation,
that's a problem.
then I wouldn't call that a risk assessment. I would call that a security incident.
Right.
And then the question is, okay, it's a security incident, is it a data breach? And there's the four-part test that's provided by the regulations that sort of leads you through the analysis that you'd have to do to decide whether that security incident rises to the level of breach. Depending on your risk tolerance, you could just say, yeah, that's a breach. We're going to treat it as a breach, and you don't have to bother with the analysis. But if you want to sort of slice and dice that a little further, you might look into it deeper and do that four-part analysis and decide whether walking out the door with a laptop rises to the level of a data breach.
Right, right. And with that, we've got just a few minutes left before we sign off. I believe we are in February. We're, I think, dark for February, but we'll be back in March for HIPAA Chat. And also in March, I think we're looking at March 1st, we're going to be hosting a cybersecurity panel discussion, virtual panel discussion with you as our moderator, which we're very excited about. And we are putting an all-star panel together as I talk about this, and should start promoting that in the next couple of weeks. So keep your eyeballs out for that. Just a reminder that if you need a deeper dive on any of these questions, or a question has popped up in your head and we're out of time to address it, please email David directly at david@harlowgroup.net and check out his very popular blog, health blog, blawg.com. David, thanks again so much for kicking off 2017 with a great and informative HIPAA Chat, and then we'll of course be regrouping again for March for another HIPAA Chat and our cybersecurity event. So that'll be big.
Great. It's always a pleasure, and I look forward to continuing the conversation on and offline.
Yep, you got it. Thanks so much.